to reuse research to look at both how systems respond and adapt to health policies, but in return, how health policies can shape and be shaped by health systems and broader determinants. So it's that really that interplay that keeps me very interested in the field. And to get a better sense of who's in the room, I thought I'd see if I can convince you to join me on a quick 2-question poll, because I'm curious what kind of policy topics you work on. And so why I love this field is that I've been able to apply the different methods of health policy analysis to numerous topics, and Kaung mentioned some of those. But every year it's a little bit different. So, areas that are close to my heart are health workforce research, obviously implementation science. But I know that there's quite a diversity of perspectives online. Oh, great. Yeah, I also am working a little bit on integrated care policies and how to scale those up. I think that's such an important area. Great, a lot of population health research, patient engagement, air pollution, climate change. I think that's another one that's I'm glad to see it pop up. Great. So thank you. And please keep those coming. I'm happy to send them back to Kangsu if there's a way to send them back with the recording. But I see a lot of a lot of diversity, but I suspect we might have some areas in common. And I'm curious, as you do your work in health policy and systems research, especially on health policy analysis, what are some of the challenges that you're facing? Data, bureaucracy. Yeah. And I can tell you a bit of about my challenges too. I honestly, as being in this field for a little bit, I came in very excited thinking that, all the decision makers will be interested in the research that we propose. And it's over the years been really a humbling experience to better understand what is the role of research, the role of funding in what research gets produced, for example. I see somebody mention, sensitivity about certain topics, the politics of research and of using research. And so I think that I share some of these areas that you are mentioning. And in addition, I often feel like, somebody mentioned silos. I often feel like that's actually something that's excited to try to overcome. And embedded research is one way in which health policy and systems researchers have tried to really connect closer to policymakers to understand what are the research questions that are really of relevance, and starting in that way. And so I think that is one that ties things together. And yeah, I see the translation of evidence into policy and practice coming in strong, and that's one that's also close to my heart. And another one that I don't see it so much, but I think it's related to this translation, is the feedback of what are the mechanisms to try to feedback the information into the decision making. And I'm trying to see, I see trust, something about generations and maybe conflicting perspectives between generations. But also there's a lot of uncertainty. And I guess that's where I feel like the world has changed. So thank you for sharing a bit of your perspectives. It's so great to learn about them. But I was reflecting as I was preparing for today, like, how did I become passionate about policy analysis, and how have things changed since? And my first sort of adventure into policy analysis was in my undergraduate work, where I'm from Romania, and I was really interested to see how did the Romanian health system change after the 1989 revolution. And this was 2005 when I was doing this research, and I was looking through history books, and I was looking, through political science theories, and I was scavenging through all the documents that were available on Ministry of Health websites. I was able to speak to some GPs, but really, I was very much looking behind me. I wasn't at that point thinking about, well, Romania is about to join the European Union. What are the implications of these findings of their transition going forward? And I think, when the COVID pandemic hit, I think probably that was something that brought a lot of people to that realization that not only do we need to act quickly in the present with uncertain information, but we also should be thinking about the future. And so I think that has motivated me a little bit to look into not just looking retrospectively to understand why things happen and why policies get implemented, why health systems change, but also trying to find the methods to look prospectively. And so it's also this shift in the decision-making context that not only are actors very much connected, but there are different arenas and networks of stakeholders that really make it quite a rapidly shifting environment. And policymaker attention is not always sort of on the same timeline as research findings come out. So it's perhaps that dissonance in timing that motivated me to look at prospective policy analysis. And so in doing so, I was looking at essentially how can we as researchers keep our finger on the pulse to analyze health policies? And then what are some of the techniques or methods or strategies that can help us and practitioners to better understand the decision-making process, knowing that it's much more complex. There's a lot of available data. There's AI coming to the scene. And how can we learn about the experiences of individuals who are engaged in this process? And so I think for me, it was the COVID pandemic that sort of brought it together. And I had this small funding opportunity to have protected time to look at this. And so that's a little bit of where this work started for me. But I'll be curious in the discussion to hear how others have been engaged in this work. And so I guess to get us on the same page, the way that health prospective policy analysis has been defined is in a couple ways, and I'll maybe just highlight the characteristics that stand out to me. And that is that it's forward-looking with real-time documentation and feedback and immediate lesson learning, and ideally feedback into action. And that's one aspect of the definition. But another one, it's also maybe a bit simpler, but this emphasis on analysis in and for the policy process, and that it involves in a number of techniques, research, but also advocacy in the problem definition and decision-making evaluation, et cetera. And so to me, this takeaway is that it's definitely applied. It's not as theoretical, perhaps, and that it entails active engagement with the policy process. And so when doing our literature review as a first step, then we found actually not that many documented cases in the literature. But that said, as we all know, things don't always get documented as such in the peer-reviewed literature, and especially for things that are sensitive and politically charged, they may not be labeled as such. So in policy analysis, what is in the literature is maybe always with a grain of salt. But I wanted to give you just an overview of what that looks like, and a little bit of what context these studies were carried out in. And so most of them looked at the feasibility of potential policy options and assessing policy impact. There were fewer that reported on informing policy advocacy and proposing policy solutions, et cetera. And there were fewer that were sort of trying to engage in the process before a policy was designed. And we can see here that in terms of the geographic context, there weren't. It was a bit of a mix, and I think there were quite a few studies that reported on multiple countries, which is why maybe some regions seem to come up. But really, the overall number is small if we think about how vast the peer-reviewed literature is. And so we found we were also curious on what kinds of questions that it may cover, and we found that prospective policy analysis has been applied with sort of the big P policies and also the little p policies. And the big P policies are, as you probably know, the public or governmental policies like laws, major national sort of policy documents. And the little p's are more private, non-governmental policies, organizational guidelines, things like that. And so I added here some examples of the topics that were covered so you can get a sense of them. And then we were also curious, at what point can researchers come in to do this kind of analysis? And so I know it's not a perfect illustration of the policy process, but we use these stages heuristic. And we noted that a lot of them were around policy formulation and policy evaluation. Less was reported on agenda setting and the other bits and pieces. And then as researchers, as I mentioned, we were curious, what are the tools and techniques and methods available to us? And also related to the data. I know several of you mentioned, the lack of data or access to data is one of the issues. And so, in thinking about what methods are used and what data is used, we saw frequently that there's a mix of primary and secondary data. A lot of case studies, the primary data collection, working with policymakers in relatively small scale. I was curious about the timing of it. And we saw that, though it's prospective and, we think we would be looking for longer periods of time, actually the time period was between 1 to 4 years. And so less frequently, just in a couple of instances, we saw some articles use social media or just media more broadly. In one case, it was the leaked policy document that was analyzed. A couple of examples of using participatory techniques like Delphi, sort of expert consensus building, social network mapping, etc. There were fewer instances where people engage with data from non-policymakers, like service providers, civil society, or constituents themselves. And so I'm hoping that this can also set the scene for opportunities of where we can have in a discussion to reconnect on what might be some opportunities for building on these strategies and approaches. And so where we thought that we would try to then put things together and see if could we draw a conclusion from the literature that we reviewed to then highlight, well, what might make prospective policy analysis unique? Why is it different than regular policy analysis? And I guess this is never to say that looking back is not important. And in many cases, it's only possible to document and reflect on things using sort of retrospective techniques. So what we thought based on what was published and sort of what our experiences were, we thought that the unique characteristics were perhaps this linkage to a dynamic policy period. And so it's that whether it's the COVID pandemic or the Trans-Pacific Partnership negotiations, it was a period where things were happening rapidly. And so that provided perhaps an entry point to do policy analysis differently. We noted that in each of the cases we examined, there had to be an intent to do it prospectively, as in it's not something that that's sufficient to happen organically, though it's possible that some folks report on it only after the fact. So that doesn't mean that they're not engaged directly. There were also notes for mechanisms of engagement and partnerships, and that's partnerships between researchers and civil society or practitioners and policymakers. And so it was that embeddedness component that was evident in many of the case studies that we found. And it's also the strategy and approach that would promote the analysis in a timely fashion. And so it was this a design that allowed for feedback in real time, and that allowed for the data to be used in a way that it would maximize how available data is used for decision making in an uncertain type of context. And so we wanted to highlight that and then to reflect on, what does that mean for the process of research and engagement? We proposed some primary outcomes and related outputs, but again, I'm hoping that's really the beginning of a conversation, because I think that thinking about doing policy analysis prospectively in an embedded fashion also calls attention to what is the role of the researcher, the researcher's independence from the process, and the sort of finding the right space for trade-offs so that one is able to conduct rigorous research and still able to engage in a timely fashion. So that's how we set the scene in terms of what it is, how do people do it? And then as part of our small grant, we had an opportunity to do an application. And in the pandemic period, there was very little primary data collection or opportunity to engage with folks directly. But our team was able to explore some of the methods that would draw on the secondary data that's available. So at that time, we thought we could use the Twitter data before X, and to try to understand, well, how can we trace these negotiations around the TRIPS waiver in this case? So there was a lot of debate about intellectual property and rights to intellectual property, and that was very important in COVID vaccines development and distribution, et cetera. And so we wanted to see if there's a way to capture it. And I have to be honest, we were probably a bit overly ambitious, because we were thinking about the stock market and the idea that there are signals that financial analysts use to determine changes in the stock market. And we were wondering, to what extent can we approximate that kind of real-time information from social media. And this was an exploratory study, but essentially we looked at the TRIPS waiver debate for a period of time. We looked at, I guess, from March 2020 over through 2022. And we also looked at media articles. And the way that we got connected to the topic is that one of our, and this is, I guess, relates to the embeddedness of our research. One of our colleagues was on a GAVI, the Global Alliance for Vaccines and Immunizations, civil society working group. And so we knew that civil society was very active in trying to promote the TRIPS waiver, and therefore set the scene for increasing access, like equitable access to vaccines and immunizations for COVID. And so we were curious to see if we could look at social media and media and to determine, who's involved in the debate, and also then what are they debating about. And so we explored 3 types of analyses. And for this, I have to really give credit to my colleague Zishi Chen, who's a PhD student graduating in a couple months in our School of Engineering. And so we were able to take advantage of this large data that was available and apply different techniques to understand, to get a sense of how to answer our research questions. And then to sort of examine the policy space, we looked at a public arenas model. And so I'll share with you just one of our aspects of our findings, because I think, we had the opportunity to explore different methods and not all of them necessarily work. And I can reflect on, how those were helpful or not. But we wanted to also then do a sub-analysis of CSOs, civil society organizations. And so this is just a part of the network that we examined. And we wanted to see, where are certain civil societies organizations active, and who are they connected to? Because we knew that civil societies wanted to play a bigger role. And at that point, they were also curious, like, is their messaging going through? And so we were able to map them also relative to other health organizations, and to confirm that they were playing the role as knowledge brokers, so sharing information across different actors, and also as advocates. And so we were able to trace that they were delivering the messages to the influencers, to the folks that were highly connected in the network, either individuals or organizations. And so we were able to look at that. Also, we were able to look at a couple different periods in the discourse and to see how these networks changed or not. But in thinking about the topics that were delivered, because we were curious both who's sending the messages and what kind of messages are they sending. And so we were looking at how the different messages were framed. And so because of the way that civil societies organizations communicate very frequently, and because they communicated both within their sort of arena space, but also across different types of stakeholders, we found that they had an emergent sort of structure that formed. And so they were able to be quite consistent in their messaging, and especially around accessibility, affordability, and not having monopolies in the vaccine development and distribution. And so we were able to feed this information back in with some of the members of the civil society working group, and get their feedback. And then we also had lessons learned about the methods that we used, and how some of these analyses were more difficult to interpret than others. We unfortunately didn't have the opportunity to have primary data collection, so we were really testing to see how far we could learn from just the secondary data available. And then I moving from that, so that was sort of like our big P example, looking at a debate that was happening globally. We handled a lot of data, and we were able to map things quite thoroughly. But what was difficult is to then dig a little bit deeper, right? Because at the global debate, we could document the policy, but we didn't know what was happening behind closed doors. We didn't have access to those spaces. So it was, in a way, we were analyzing the policy, but only what was visible to us. And so in my current work, I'm exploring something much smaller scale, but I wanted to share with you also a little P example. This is a work in progress, looking at understanding how resources are allocated for language access, so for interpreters. looking at Latinx immigrants with limited English proficiency in Baltimore. And this is a small, very small pilot grant that we have. It's building on some work that is looking to strengthen teams, so team collaboration between interpreters and therapists and families. And so essentially we were interested in it because in Baltimore, there are a lot of immigrants that have limited English proficiency. And especially after the COVID pandemic, the mental health needs are greater. There's always unmet demand because there are not that many interpreters, not that many bilingual providers. And so waiting times are actually quite long. But there are certain decisions that health systems like the Johns Hopkins Hospital, medical institutions make that determine how language access services are organized. And so we wanted to look at this to understand, to do an assessment of how is our medical institutions language access program organized? How is their policy for language access implemented? And then to see, you know, how could that be informed by the perspectives of therapists, perspectives of the language access providers themselves, and that of patients. And so this research involves a little bit of review of existing practices, looking to see, you know, how do people allocate resources to language access models broadly, maybe looking at a couple of case studies in the United States. And then in partnership with the language access administrators at Hopkins, looking at assessing the current system, seeing how it meets sort of the standards set by the federal language access policies, and then to think through how can we develop some decision support tools that help to allocate existing resources better. And so some of the decisions, for example, relate to, you know, when do you call an interpreter? You know, what is the waiting time that doesn't compromise somebody's need to access a therapist and get care sooner? And so there are a number of different decisions that have to be made that have resource implications. And so in this work, we're trying to see if we can sort of attach ourselves to this organizational policy and analyze it and then propose something to implement, which would then have to be evaluated, you know, if we have an opportunity to get additional funding, but also to be able to sort of engage with folks in real time as they're trying to figure out these challenges. And so this one has that connection also to the implementation bit, not just sort of the policy analysis. And so that's our little P example that I wanted to share with you today, where we're trying to you know, apply some of these principles for prospective policy analysis. And then last but not least, I wanted to share some future work that we'd like to do, but you know, as things in research depend on funding. But in terms of working, the broader topic is the decarbonizing health systems in Baltimore. But the specific bit is looking at how medical waste is managed, and how, you know, what are the multiple layers of incentives created by policies at the federal, at the state, at the city level that promote this medical waste incinerator that is currently the largest in the country, and that, you know, takes in not just medical waste from Baltimore, but also from quite a lot of locations outside, and trying to see how one could both understand the policies, but also engage in the context, in the ongoing debates at the city level. And so there are, Baltimore has a lot of community-based organizations that are very active in the space. And so we're exploring to be able to provide them information for the policy incentives and sort of the conditions that are continuing to facilitate these actors that are not just damaging, potentially damaging the environment in Baltimore disproportionately to what, the type of waste that is created locally, but also the communities that live in South Baltimore that are affected by the byproducts of medical waste incineration. And so this connects to decarbonizing health systems because there are different ways to handle waste, but of course there are resource implications and political implications to shifting models. And so in this case, we're trying to work more closely with community-based organizations and to try to inform their agenda. But to be, this is also a set of relationships that needs time to cultivate and, to find the openings in the policy process is also something that we're trying to explore. So this is more of a work in progress. I don't think we have like necessarily anything to report or like, actionable steps at the moment, but to give you a flavor of, important policy issues where they're not necessarily researcher-led. It's these community organizations that already have a large agenda and initiatives, but an opportunity where research can come in handy. So for example, our colleagues in the Department of Environmental Health and Engineering can regularly testify because they're the ones that measure the air pollution that is near the incinerator. And so I'm thinking then about, well, what is the type of information that would be helpful from the health side to inform this policy debate. And so I wanted that this is more of a reflective example, but I hope we can talk through it, and maybe you have examples of your own that is sort of that are sort of in process. Excuse me, but I guess I wanted to leave you with some reflections, and these are my own, but would love to discuss them with you. And so I think I had a lot of enthusiasm, and I still have a lot of enthusiasm about doing policy analysis in real time and forward-looking. But I think going back to some of the challenges that were mentioned also in the beginning, real-time data is not always easy to access, and it's not always a reliable single source of information. And this is not necessarily surprising, but I think the stock market model that would be available to health policy is probably not apples to apples kind of comparison. The health policy process it involves a lot of the qualitative sort of relationship building and things that wouldn't necessarily be visible. And so secondary data doesn't always paint the full picture. And there might be bias because oftentimes, like at least in the social media, the one we were able to analyze was only in English. So even in our TRIPS waiver debate, it was missing out on all of the data that was not available in English. And that's partly because at that point, the language access models that we were trying to work with we couldn't train them in different languages, but I suspect that kind of technological issue would be resolved in the future. And there is, I think, a lot of opportunity to look at social media and public comments. It's not a perfect depiction of public opinion, but it does give a sense of some of the perspectives. And then maybe the last thought is that building relationships is so important, and but this requires long-term engagement. So in many ways, being able to do this kind of perspective analysis has to rest on a foundation, or it has to invest sufficiently in a foundation of relationships where there is trust between decision makers and researchers and civil society actors. And that requires a lot of investment and a lot of commitment, I guess, and also a very good understanding of the context. I think there's a lot to be learned about how policymakers use research evidence. And I think there's a lot of opportunity for researchers to explore, different strategies for embedded research, different ways to do participatory development of research with policymakers. And so I think that will also, it's not only an exciting area, but it's also an area that I think will help with, improving this application of prospective policy analysis. So I think I think that was my last slide. So I want to thank you for listening to me. Thank you for your engagement, and I'm very excited to hear any questions that you might have, and also experiences that you have that you might resonate with some of the topics discussed. So thank you so much, Kang-Soo. Over back to you.
Thank you, Ligia. It's very clear presentation, and we have a one question in Q&A. So let's start with that questions. Can you share a bit more on your experience, challenges, who and how you engage with actors with translating evidence from your research to policy and practice changes?
Thank you. Thank you for that question. And so in my experience, I think, for example, in our evaluations, our team always maintains emphasis on disseminating to a number of actors. And so that is dissemination to, but local actors where policies, the research is carried out, but also to funders and to sort of the broader community. And so there are different layers to that kind of sharing and translating research. But what is harder to know is whether that sharing and dissemination translates and makes an impact in decision making. And I think my experience is that we sort of try to do it, but it's harder to know what happens after, right? Because our evaluation, our policies, our projects end. And so in some cases, we get to sort of remain engaged as researchers, but in many cases, it's almost like a different phase begins and the information's put out there. And that's why I think it's exciting to think about, well, what does it mean to use research evidence? And what are our theories about how that happens? Because a lot of our assumptions or like our theory of change is based on, well, policymakers may not know this information, so we share it with them. Now they know, they will act differently. And that's not necessarily how information is used. And there are, it's not just research that is used in decision making, it's also informal information, gray literature, experiences. And so I think the challenge is knowing how to get research to shine in sort of this sea of information and sea of sometimes politically important debates, et cetera, and how to make research shine through that and in a way that is practical. And so, yes, I think the use of research evidence is very important. And I think that's something that one would explore further. And I think there's different ways to do it, like with engagement, like policy dialogues, participatory engagement. And so disseminating differently would be something I'm trying to explore and would love to learn about from any experiences in the group.
Yeah. That's also one of the beauty of prospective policy analysis, because it's ongoing process. And since we are engaging with the policymaker throughout the process, so it can be kind of a participatory research. And then there is one more question from the audience. So besides engaging with policymaker, does research involve the beneficiary? So do they have a voice in advocating for change?
Yeah, thank you for that. Thank you for that question. And so in our big P study looking at the COVID TRIPS waiver, we picked up the dialogues, from all over the social media. And there we were thinking that, well, probably civil society would be the one advocating on social media for beneficiaries. We did not have direct engagement with beneficiaries, not having, a primary data component. in our little P study, looking at language access, um, so we're sort of working together on like a couple of different projects. And so the work that I was telling you about, building on improving teamwork, that involves patients, so the youth and their families, because this is around like pediatric mental health. And we're trying to engage them and get their perspectives, not just from qualitative data, which I guess is this, like more research approach, but also through group model building style, like a systems thinking style workshop, where everybody sort of is able to reflect on these findings together and co-create some ideas for how do we overcome the barriers that we collected, through our various discussions. And so, but I think it's very important, and it's not always clear how, it may not, unless you're close to the context, it may be hard to do. And so I wonder if it's perhaps easier to do when you're closer to the problem, closer to the context, rather than on these larger global issues where you're more removed.
Yeah. And then there is one interesting question related to the AI. So how can researcher research and advise policymaker on ways to be updated on AI progressions and policy making on regulations? And given on how fast AI development is outpacing policymaker ability to regulate AI and researcher understanding of AI. So could you kindly briefly share about the AI development and how the policymaker engage with this development and how the policy analysis can be contributed in this field?
Yeah, thank you so much. And I should say that I'm probably not the best person to speak on AI progression and the regulations that different policymakers are putting in place. But I think that AI can also provide a lot of opportunity. And I think as part of that, it's also researchers to remain updated. And I feel like this is an area that's moving very fast, and I know very few people, not myself included, that are able to stay abreast and to know what the tools are and to use them. One idea, so not on regulation and ethics, I think that's quite an important sort of ongoing dialogue that if folks can participate in, they would be important. And I can share with Kaung, there's been a couple of really interesting pieces on sort of the ethics of AI and use of AI. And so I think maybe keeping up to that debate, but on the engagement, I'm not yet sure what that would look like from like a specific like a policy analysis lens. Maybe last thing to say is that I think we should all explore to the extent to which AI can help us not replace the synthesis, but help us in doing more rapid synthesis. And that's something that I think could be explored, as a tool to help put process research faster for research use.
Thank you, Ligia. And I found one question from Tofit and it's very interesting. Maybe Tofit, you can ask directly so that the audience can also learn from the discussion, which is about the global health fund cut.
I don't know, my sound is audible. Can you hear me, Ligia?
Yes, I can.
Yeah, I'm actually projecting from my laptop to a projector, so I'm not sure how the sound is actually going. My question is about the funding situation. Health policy and systems research traditionally got little funding actually as it should have. We always complained about allocating more fund on clinical research and technology-based research rather than health policy and systems research and health systems strengthening. Now, prospective policy analysis is even a niche area, even a more niche area within the broader area of health policy and systems research. And with the new funding constraints imposed by various governments on global health grants, how do you anticipate, how do you see the prospect of prospective policy analysis in the coming days, and how to navigate this situation? Do you have any ideas on how to go for alternative funding mechanisms or anything that can work for prospective policy analysis?
Mm-hmm. Yeah, no, those are important questions, and I probably won't have an answer to it, but I guess maybe two reflections. And one is from, the last example I gave is one example where we're looking to, build these partnerships and work for the policy process that is engaged, through the local organizations. And folks from those organizations, they participate in community meetings, they go to hearings at the city hall. They're there every day, irrespective of whether there's funding or not. And I think that is a difference, perhaps, in how the funding models has been set up by research, where research is so dependent on, having a specific pot of money to do a particular activity, which requires somebody to agree to give you that money for that activity, right? These are not, there's very few sort of open research funding opportunities available. And so I think that sort of the community organizing and civil society movements, they work to try to influence policy irrespective of whether there's a research study available. And so I think researchers have to get creative, maybe through, having dedicated time to volunteer with local organizations, or to be able to be engaged in these, processes. From a, maybe I'll just reflect on my own personal situation, but it's very difficult for me with having young children to be able to dedicate evenings to that, though I am fully, supportive and passionate about it, but it's just not possible in my current sort of arrangement. But I've been very impressed about what students can do, about being able to work with, let's say, practicums or internships. And so I think it's about being creative to stay embedded in local research processes. And then these bigger ones, right? Like the Global Fund often funded global research. So to do things that are maybe across the different contexts, I think that maybe requires being creative of trying to do these kinds of analysis as part of our ongoing work. Because what makes it niche is that it hasn't been published on a lot and called this way, but it's actually not niche because many people do this kind of work and they just don't publish about it. And so I would argue that being involved in trying to get our research to be used in real time and for it to be relevant for policymakers is something we should do irrespective of whether we call it a specific policy analysis or not. So that's not helpful. But that reflects on, I had a conversation with a colleague yesterday where I was saying, okay, yes, we have this project, but I have sort of a secret research agenda where I'm also curious about, let's say, how the global funding cuts are affecting health workers. And so trying to embed it in existing work is one sort of coping mechanism in the absence of having dedicated funding for it. And I think that's going to require more creativity now that there's more of these global cuts. But would love to hear your thoughts on it, Tawfiq, as well, if you're willing to share, because this is an area that I think is ripe for creative solutions.
Yeah, to be honest, I also don't have a clear answer, but overall, it's not just about like prospective policy analysis. In general, the discussion is around encouraging the governments to dedicate more internal resources for this type of work, because policy analysis eventually help the governments of different countries or institutions in those countries. So instead of like looking for external big donors, perhaps doing some advocacy with the governments to make them understand that this is what that's going to help them big way, and they should be dedicating more resources for that, could fill up some of the void created by the global health donors. So that could be one way. I know it's very difficult, but still, that could be a way that we have been discussing in a global conference recently in Vietnam.
And I saw one hand raised from Josephine. Josephine, do you have any specific questions or comments? Hello, you can unmute from your end, Josephine.
Yeah, I can. Sorry.
Thanks.
Yeah. Thank you, Ligia. Nice to see you online again, and
Yeah.
Taufik and all others. I didn't hear so much talking about the actor lens and the role of power, and with the increasing polarization everywhere, but also on your side of the ocean, I think that becomes an increasingly irrelevant topic for you as researchers. So I wondered, in this domain, do you take power into account, and how do you do that? And related to that, how do you prevent or deal with the sensitivities of engagement, embedding what you just explained about linking to civil society organizations? I can fully understand, but at the same time, that risks you being drawn into one of the sides of polarization. So a few reflections on that would be useful, I think.
Yeah, thank you so much, Josephine. I mean, very, very important topic, and as you say, quite current. I think and I don't know that I have I don't know that I have a stance on this, but I think there's a lot of debate among policy researchers around the role of the researcher and whether they should sort of stay independent and provide sort of an independent lens, or once you become more embedded and engaged in the policy process, you become connected to it. You may be coming in spaces where you can't maintain that independent lens. And so I think that's one aspect of the debate, and the extent to which independence is important might vary by the research question. And I know that researchers are often also quite active in also their personal capacities. And so I think it's that sort of balance that folks will balance individually. You mentioned the engagement with community and civil society, and I think that's also an important. I guess I think about power in terms of like the different spaces in which power is created, and where are you invited? Kind of like that power cube sort of analogy. I think it's quite practical and relevant to thinking through at least the work that I've been involved in. And so, for example, in the work with the community, this last example that I mentioned, I don't think that we would be invited in all of the spaces, even from the community side. So I think there's often an assumption that, policymakers don't necessarily invite researchers in, but I think there's a lot of trust that needs to be built also with community organizations. And I say that in Baltimore because, Hopkins University has a history of engaging and not engaging the community when at different points in history. And so there's power dynamics there too, and trust issues that need to be overcome. And so maybe the short answer is that power and sort of the implications of it are so important. Whether and how those are grappled with, I think varies by, whether you're like which actors you're engaging with, and like whether it's sort of like the big P policy where you're, let's say, working to change a city council agreement versus like where you're working at the institution. I think the power dynamics just a bit different there. But yes, it's how to navigate that, especially in today's world. It's harder to know. I don't know that I have a conclusive answer on that. I think I'm still trying to figure that out as well, to be honest.
Yeah, thank you. I agree. And that's work in progress as we speak, I think. Yeah.
Yeah, but just to say that it's I sometimes naively assume that researchers would always be invited into some spaces, and that's an assumption that I've been humbled to find out that it's you have to work to gain trust and to build those relationships. And I think for that it's hard to stay independent. Like you have to invest, you have to give up some of that independence and distance in order to build those trust and relationships. But to what degree, I think that varies. Yeah,
that's an important observation. I think that if you decide that trust is a bigger, no, it's not a value, but anyhow, yeah, it reflects about the trade-offs of a trustful relationship versus your whether, I don't say it does, but whether your credibility as a researcher is affected by that. That might indeed be a bit of a balance about which it would be interesting to think about that a bit more.
Yeah, no, I appreciate that. And just to say that I think that thinking back about the literature, I don't know, I mean, folks talk about the role of the researcher more from like a reflexivity standpoint, but not necessarily from the power relationships. And so that's also something that, maybe is an area for reflection for researchers, but also just maybe, opening the discussion more also with future generations of researchers. Because I know that at least I was personally trained often in more of like, research is independent and you have to, maintain sometimes some walls of to some degree around it. Yeah.
We are kind of quite right timing, and it's around 4 p.m. here and 1 hour left. We still have some questions, but I think I will pick up the last one, and then after that, we can finish our session. So the last question is about how can prospective political economy analysis incorporate into equity and ensure marginalized populations are properly represented. So that's one thing we trying to involve in our policy analysis, but sometimes it's kind of quite difficult to reaching out to the marginalized population and how to ensure that policy analysis does not increase existing equity or disparity issue.
That's such an important question. And it's also so that it doesn't increase disparities, but it also doesn't put marginalized populations at disproportionate risk or at increased risk. And so I think that's also a balance. I guess if the topic is around those topics relevant to marginalized populations, I think it's important to be sensitive to, how would they like to be represented and included? It's again, it's hard to make assumptions about availability of time and but I think engaging and making sure that the research questions are relevant to them is an important first step, and that maybe sort of the low-hanging fruit. I think over time maybe it goes back to being a trusted resource also by those communities, I would like to say that we should practice co-creation and always do this kind of participatory engagement, but sometimes that assumes that folks can take time off from work to participate, and that even that engagement will be pay dividends when it comes to decision making. And so I think it's definitely important, and one should not exclude voices of folks that are affected and for which policy analysis is important. But I think we have to continue thinking about, well, what is the best way to engage folks, and working through civil society organizations that represent the communities could be one way, although that knowing the context is important, as you know, all organizations have their own goals and experiences on the ground, which may also be political at times. But yeah, I think also engaging to make sure that not just the research questions are relevant, but also like what comes out is fed back. I think feedback, we often easily think about feedback in these, like, let's say, dissemination workshops, breakfast meetings, but that doesn't always involve direct feedback to, let's say, the patients from which data was collected. And so I think perhaps, trying to include those creative feedbacks, even of research findings, back is important. So yeah, maybe those are some initial reflections.
Yeah, it's
But an
very
area that
helpful.
I feel like I'm constantly learning about as well. And an area that I feel like, we're all trying to do better in.
Yeah, we are also in the process of integrating and digesting all the aspects like AI, equity, and just kind of co-creation, and then also integrating the digital interventions. So it's kind of ongoing learning process for all of us. And now we are kind of time to close our webinar. So thank you all for joining our webinar. And we are trying our best to invite the speaker around the world to share about the health policy and system research and the global health research related topic. And thank you, Ligia, for giving your precious time and sharing your insight on prospective policy analysis based on the literature review, secondary data analysis, and how to engage with the policymaker, how to involve the community in very comprehensive and easy to understand way. Yeah. Tawfiq, do
Thank
you
you
want
so
to
much
add
for having
anything?
me.
No, I just want to reflect or just reflect on what you just said. I mean, I also want to thank you. It was really helpful to understand, especially one important takeaway for me was the value of advocacy in prospective policy analysis, which came out in your presentation. We often actually forget about that. It's not just learning something, it's about like influencing the people in the power and in the policy making process to make the change. So we need some advocacy, or we need to actually sprinkle the salt of advocacy throughout our the process of prospective policy analysis. That's how I see it. And that was actually a learning or takeaway for me. Thanks for your time and for excellent presentation, Ligia. Really look forward to working and hearing perhaps more from you in the future.
Yeah.
Yeah,
We
thank you
recorded
so
this
much.
webinar and we will post it on our YouTube channel. And we will also disseminate all the attendees.
Thank you. Bye.
Thank you. Thank you so much.
Bye-bye.
Bye.